So as many of you know, Define Colorado has focused our efforts on improving safe sleep practices in the NICU with the hope that we improve compliance post-discharge, recognizing that preterm infants are 2 to 4 times more likely to experience SIDS or suffocation-related deaths after discharge. So I wanted to provide this Sleep Well update, first with some data, and then with our videos, which fingers crossed, I'm hoping nope, I'm getting a no, will not be shared. Okay. We'll just roll with it. Okay, data. So this data most recently was collected, I want to say it's the end of second quarter of this year. And so if you recall, these are parent-reported data. We are asking families what they are observing around the time of discharge and then what they're practicing post-discharge. So here we're seeing parental report of what they're observing in the sleep area near the time of discharge in their infant sleep area. And so we're seeing that there's a fair percentage of safe items like pacifiers and suction bulbs that are seen, but we still have a smattering of other unsafe objects like towels, burp cloths, diapers, wipes, stuffed toys, and blankets in the crib area. In terms of sleep location, families are reporting that they're observing their infant in the crib or the warmer, an isolette, on the caregiver awake, we consider that to be safe, but we have about 9% of families reporting that they're in some sort of sitting device during sleep. They're on a caregiver while the caregiver is asleep, and then some others. In terms of sleep position, here we see in the dark orange, that's what families are reporting that they're doing at home. And then in the lighter, more yellowish color, that's what they're observing around the time of discharge in the NICU. You can see that 94% of our respondents report doing back sleeping. And we have about 57% reporting back sleeping observed in the NICU. 22% in the NICU report side sleeping, and then 9% report observing stomach sleeping. Shown here is parental report of what they're doing post-discharge. On the left, you can see that the yellow bars are considered what's safe. So we have 69% reporting use of a sleep sack, 95% reporting the infant is sleeping in a crib, so a separate sleep space. And then we have unsafe sleep positions, or I would say locations, as well as items that are in the sleep area. 9% reporting the infant sleeping on a bed or a mattress, 9% in a couch, 48% in an infant seat, 8% with blankets in the area, 3% pillows, and then 5% bumper pads. We also ask questions about whether or not the infant is sleeping alone, meaning a separate sleep space and not co-bedding with a caregiver. And we have 70% that report that the infant is always in a separate sleep area. However, 30% of our families that we discharge are reporting that the infant is either often, sometimes, or rarely, co-sleeping with another caregiver. Shown here is a process control chart. So we're looking at NICU safe sleep behaviors over time. So parental report of what they're observing, and the light blue is the report of safe positioning, so on the back only. So if we just focus on that teal blue, I think there is an upward trend. That last quarter looks very good. In terms of the dark bluish, this is location. And so this would be, not sleeping on an infant sitting device or on a sleeping caregiver. This is, I think, kind of holding steady-ish, I would say, hovering around 70 to 80%. And then finally, we have items in the sleep area. And so we can see that for the majority of the time, I think there are safe items, but anywhere from about 80 to 90%. And then here we're seeing overall safe sleep compliance. So, every aspect of safe sleep being adhered to, so position, items, and then a separate sleep space or in a crib. Shown in orange is what families are observing in the NICU, and then in green is what families are doing at home. So this is full safe sleep compliance. So it looks like our NICU compliance seems to be improving over time since the focus on the Sleep Well effort as a collaborative. But you can see that family report of safe sleep is still at around 50%. So clearly there are lots of opportunities to engage our families in equitable ways to better understand the factors that are driving whether or not they adhere to safe sleep. And so in thinking about what our intervention approaches or toolkits are going to look like, we are, reaching out and looking at some studies, both quantitative and qualitative. Now, Gabby earlier this morning talked about the theory of planned behavior framework, which posits that one's attitude, subjective norms, perceived behavioral control about a specific behavior informs the intention, whether or not you think you're going to do something, which then ultimately determines whether or not you carry out that behavior. And so we conducted 23 in-depth interviews of English or Spanish-speaking mothers of preterm infants discharged from 4 NICUs across the U.S. to better understand these domains that would then inform what we want to put in our intervention toolkit. So in terms of attitudes, what we found is that mothers' fear about their infant's vulnerable preterm state related to suffocation, apnea of prematurity, and reflux influence their own safe infant sleep behaviors. So clearly, this is a specific area that we need to target in our own educational approaches. In terms of subjective norms, the mothers reported that the education that they received in the NICU and advice from other healthcare providers, families and friends, and media impacted their choices. So all the work that we're doing around modeling education as early as possible in the hospital stay is really, really important. And then lastly, perceived behavioral control. Mothers often adapted infant sleep practices to meet their own needs and address the perceived safety and comfort of their infants. So meaning there are some mothers who reported that even though a specific sleep practice was unsafe for them, they thought that it was their way of ensuring the safety of their infant after discharge. And so what does then engagement in education look like for our preterm families? And I'll tell you, it's going to look real different than what's out there for full-term infants whose families have never had the NICU experience. And so I was going to show you these great safe sleep videos that have just been developed with our Children's Hospital marketing folks. And these are 4 educational videos to be used during the NICU stay. They're short, about 90 seconds to about 2 minutes, focused on the developmental stage of that infant with respect to sleep. And so in terms of what implementation might look like, we are talking through that actively. So we've got to figure out how we integrate this into your own safe sleep efforts and the timing and the individual who handles the introduction. So video 1 is shortly after admission. These babies are not eligible for safe sleep. They're intubated, they're on CPAP, they need various positioning devices. And so that's what the first video highlights, that their baby's not yet ready, but will be eventually. But what they are observing in the NICU is not what they probably have heard about as being considered safe sleep in terms of what's out there in the media. The second video is as babies are becoming eligible to engage in safe sleep. So that transition. So they may be 32 weeks, 1,500 grams, not need positive pressure. And so what does that transition to safe sleep look like? So we go through that. Video 3 is around the time of discharge. How do we prepare for discharge home? How do we get the home ready for safe sleep practices? And finally, video 4, the link is sent to families about a month after discharge to provide encouragement and reinforcement to continue safe sleep practices. So we will share all these videos with you once they're finalized. We're real close to having the final versions ready. They will live on the Children's Hospital YouTube channel. We all know there's branding issues and accessing, resources from different hospital systems, but this YouTube site, while it is Children's Hospital branded, is accessible to anyone outside. So once it's launched, we'll make sure that you all can see it. And most importantly, what does the implementation look like, right? How do you think about this in your workflow? Who's going to do it? When? What else is happening around safe sleep around the time? So more to come on that. Questions, concerns about that? Okay, so very excited to eventually show it to you. All right, so next I need to get my little award here and